I think if we're going to legitimately close the gap between Indigenous health and mainstream health, we actually need to look at what are the factors that are contributing to the health circumstances of Indigenous people. And that involves looking at the environment in which they're exposed to it. So it's about responding to how are they employed, what is it, the education like, what health services are available. It's all of those kind of things, because all of those things impact on a person's health in unique and particular ways. The interesting thing about looking at the last decade worth of reports into Indigenous family violence is that the governments receive the reports, they discuss what kind of response they're going to have. In Western Australia, they committed $75 million to responding to family violence and sexual assault in their communities. But 18 months later, nobody knows how those funds are spent. People on the ground are saying nothing's changed. We can't see what this has resulted in. And a lot of that is because the capacity within those service organisations, within those government departments, isn't there. You know, they realise how big the problem is, they realise they've got to do something, but they're not, haven't got the capacity to actually sustain it over a long period. And that's the frustration for those community organisations that are out on the ground doing those hard yards, responding to their community needs, that they're not getting the support they need because it's not as understood as it should be at that government level. I think you have to go at the pace that the community's at. I think, and you know, in 2003, 2004, ATSIC, the Aboriginal and Torres Strait Islanders Commission, provided each ATSIC regional council with $75,000 to raise awareness about family violence and to think about how they, as a council, were going to respond to family violence, to develop an action plan for their region. That started a discussion. It started talk in many communities across Australia. They were never supported post the demise of ATSIC to continue that discussion. And I think it's really time to revisit that discussion with local communities to say, what is the extent of the problem in your area? What kind of services do you need to respond to the problem? What kind of services exist already? And what are the positives and negatives of those services? How can we enhance those services to meet your needs? It's about looking at the system critically in partnership with the people that are affected by this and letting them dictate to you, I suppose, about what is the most appropriate way to move forward and letting them lead it. And I think, you know, there's some fabulous women out in the local communities. You only have to find one person that wants to lead the way and they will find others to lead with them. And I think they're the people that we need to be focusing our energies on and investing in them to actually pave a pathway forward. Part of getting the service delivery right is actually being reflective on where we're at and how we're going. The present government is saying evidence-based policy. We have a decade's worth of government commissioned reports into family violence. Let's go back to those recommendations. Let's revisit those recommendations with those task force, with those people that provided evidence to those task force. Let's get it right. Let's use that evidence and those skills and knowledge bases to actually refine our pathways forward. Let's not leave them on the shelf to gather dust when in fact they could be the catalyst, I suppose, for what we do into the future. The National Aboriginal and Torres Strait Islander Social Survey from 2002, and whilst there are problems in gathering data and statistics are not always reliable, and in fact are largely an underestimate of the actual violence that communities experience, what that survey did tell us was that the violence, as it was reported in that survey, was similar in distribution in urban settings to rural and remote settings. Again, I think there has been a large focus on the deficits in rural and remote areas, and it's been easy to show that the communities in rural and remote areas look like ghettos. They look a particular way, and if they look this particular way, then they've got to be violent. But in urban settings, violence happens too. In urban settings, I would argue that it's much more hidden. You can have violence in a suburban area and your neighbours don't know. The access to support can be even more limited in that suburban area, I would argue. And so, I think we mustn't forget that violence occurs in all communities and that we can't just focus our attention in rural or remote. We also need to look at urban settings. We also need to acknowledge that, hey, 70% of the Indigenous population lives in urban settings. And what does that mean in terms of Indigenous family violence and an appropriate response?